All right. Thank you, everyone, for joining us today. Jillian, if you want to advance to the next slide.
Oh, wait.
Apparently, our technical issues are persisting.
Sorry.
All right. And it looks like Jillian is back. Good evening, everyone. My name is Linda Painter. I'm the Director of Planning and Development for the town of Mansfield, and I want to thank everyone for coming to this evening's public hearing. We're here this evening to talk about the Helping Hands program. This program is funded by a Small Cities Community Development Block Grant. And so the first thing we're going to do this evening is just give you a little bit of an overview of the Community Development Block Grant program and what it's intended to do. Then we're going to go into the status of the Helping Hands program. And last, but definitely the most important part of the evening is community feedback. We want to hear from you about your experience with the program, if you have suggestions on how we can do better. So with that, we'll go to the next slide and we'll tell you a little bit about what this program is. So the Community Development Block Grant Program is a national funding program from the Department of Housing and Urban Development. Because Mansfield is a smaller community, we do not get funds directly from HUD. We apply for them through a competitive process through the Connecticut Department of Housing. And the primary goal of the CDBG or Small Cities funding is really to support communities in terms of providing decent housing, suitable living environments, and expanding economic opportunities, primarily for persons of low and moderate income. And so one of the things that you'll see on the slide is that in order for the program itself limits the types of activities that we can do, but any activity, even within a list that may be allowed, has to meet one of three national objectives. It either needs to provide benefits to low and moderate income persons, or it has to aid in the prevention of slums or blight, or provide funding for projects that have a particular urgency because existing conditions pose a serious and immediate threat to the health or welfare of the community. So for the last one, an example might be some of the funding that came through from the damage from major hurricanes. That would be an example of HUD where they provided some emergency funding. In this particular case, the CARES Act, which was the first, I believe, funding bill from Congress to help deal with the impacts of the COVID-19 pandemic, provided supplemental funding for this program. So beyond the normal annual allocation, Congress provided additional funding for activities that would help communities prepare for COVID-19, prevent the spread of COVID-19, and respond to the fallout of COVID-19. Jillian, you want to go to the next slide? So this slide just shows you examples of things that the state of Connecticut identified. And I will say the state had a narrower list that they authorized communities to choose from in terms of activities than HUD did. But it shows you basically three categories: rehabilitation of buildings and improvements, planning and capacity improvements, technical assistance, and the last one was provision of new quantifiable increased public services. And that's what the Helping Hands program falls under. Back in August of 2020, after talking with our human services staff, and should have done introductions at the beginning, so I'm going to do them now. Jolene Woodmansey, I think most folks on the line here know. Jolene is a planner one in our office, and she is also the grant administrator and program coordinator for the Helping Hands program. We also have Pat Schneider here, our director of human services, and Dorothy Delval, who is an administrative specialist in the Department of Human Services. And I think most of you work with her as well very closely, particularly when it comes to food assistance. So looking at the needs of the community back in August of 2020, we identified three particular activities that we sought funding for. One was assistance with childcare costs, recognizing that childcare is not affordable, even in normal times, much less at a time when parents were struggling to be able to work and care for their children with schools closed. Food security and nutrition assistance was also another identified need, again, as people were finding themselves with decreased income, increased revenue, or increased expenses rather. And last, we also requested to be able to provide rental assistance. And so the town's application was for $500,000 to do those 3 activities. The state ultimately did give us the $500,000, but did not authorize us to provide rental assistance. And I believe that the reasoning behind that was that several $1 million had been allocated by the state for rental assistance programs. So they did not think that there was a local need for that type of assistance. So we are just over a year now since we started the program. Angeline's gonna take us to the next slide. And here are the 2 types of assistance that we are offering. So for childcare assistance, we can provide up to 6 months or 26 weeks of assistance with childcare expenses. The parents do cover 7%. Do cover a portion of the childcare cost that's equivalent to 7% of their household income, and that is the standard at which childcare has been deemed affordable by the U.S. Department of Health and Human Services. So we look at what the total cost of childcare is over the period of assistance, and the parent will pay 7%. If there's any other assistance being provided, for example, care for kids, that's factored in, and then we will pay the gap between what other programs are not covering and that 7%. And for a lot of our families that have used this so far, there haven't been a lot of other funding sources for them, and we've seen it primarily used for childcare. We do allow for up to $9,000 per household. I will say it's very rare for someone to reach this threshold, because you're really at $9,000 looking at probably multiple children for several weeks. And the payment is provided directly to the child care provider, and this is a HUD rule. So this is a very specific type of assistance. The limit of 26 weeks comes directly from HUD, as does the requirement that we have to pay the child care provider. We do, for our policies do require that child care providers be licensed, just to protect the town, since we're doing payment for services. That is our childcare program. And then for food assistance, what we had requested the ability to do was to basically fund staple groceries and prepared meals. And I think the program, in terms of how it's operating today, is a little bit different than how we had originally anticipated doing it. However, I think there are also some benefits to the way in which we're doing it today, which we'll get into. So in terms of the program budget, and this breakdown was actually established by the State Department of Housing for that $500,000 award. And they basically have given us a budget that says $471,500 of that award must go towards what they consider program delivery costs. And so that means food, childcare. It can be used for staff time that's associated with program activities, such as assisting applicants, purchasing food, marketing expenses, translation expenses, things of that nature. And then $28,500 of the budget can be used for program administration. So this is legal notices that we place for hearings. It's procurement of services and the legal notices that we have to do associated with that, as well as reporting. And one of the things that I wanted to mention is that a very specific decision was really made at the outset of this project by the town manager, that those of us who are full-time staff, even though we have other responsibilities, as long as this is within our regular work, the work we're doing is within the regular work hours, we don't charge it to the grant. So all of Jillian's time is none of that is being paid for by the grant. The time that I spend on the project is not being paid for by the grant. Same with our administrative assistant, Sandra Forand. We do have one person where the hours that she spends on the grant are coming out, and that's because those are hours in additional to her normal work week. So it's above and beyond her normal work week. So we are using that for some staff funding. But the decision was really made early on that we wanted as much of this money to go to the residents as we possibly could, and not to subsidize staff expenses or town expenses. So in terms of where we are, as I said, we're in this now just over a year. We received the funding award, were notified in, I think, December 2020, January 2021. And in our application, we had identified a goal of assisting at least 100 households over a 2-year assistance period from January 21 to December 22. And as of February 4th, we are just shy of that number in terms of households, that not including Juniper Hill residents. And we'll cover that in a second. I'm going to turn that over to Jolene to handle. But essentially, you'll see the breakdown on the screen. Most of the households that we're working with are just receiving food assistance. We have four households that have received childcare assistance that have not asked for food and not requested any food assistance, and 11 that are receiving both food and childcare right now. And with that, I'm going to turn it over to Jolene, who is going to go into the program we're doing with Juniper Hill.
So in February, we started providing Juniper Hill the prepared meal portion of the grant. So they already did prepared meals there, so it was kind of an easy transition for us. So anybody that wants it can get their lunchtime meal paid for by the grant. So that's Juniper Hill.
So that's actually, so 102 residents, I think, is the total resident number. Not all of them have taken part in this. I don't think all get the meals, but we're working with the social work staff. So anyone who chooses those meals, we will pick up the cost. We know that all of them are income qualified. So the one thing about this program is that 100% of the funds are going to low and moderate income families, and as defined by HUD. So we're not serving anyone who does not meet those income criteria. So the next slide you have on your screen talks about kind of where we are in terms of the overall expenditures. And so just to kind of go from the largest slice of the pie first, that $284,458 is what is currently unexpended and uncommitted. The second largest slice of that pie, $131,040, is what we are estimating for 6 months of Juniper Hill meal assistance. And that's assuming that 90 residents had meals every day of the week for 6 months. So from our first invoice that we just received today, it does not look like that is the case, but we want to make sure that we are providing funding for that. The childcare assistance right now has been a little bit over $30,000. As I mentioned previously, most of our families have opted to use that for summer childcare, so through various camps. And then we have food assistance, and about a little over $40,000. I will say that these expenditures are only through February 4th. A lot of the work that we do uses purchasing cards, and especially for groceries, and those we do not have that data yet because the period actually closes tomorrow, so we don't have February data in. Based on previous expenditures, we're expecting probably around $15,000 in groceries for the month of February, as we've increased the number of families that are getting groceries through this program. The 8,400 that you see in the tan slice, that is used for, as I said, portions of staff salaries, namely Dorothy and a former part-time employee that helped out with the program, and things such as marketing, so the postcards that went out in the mail, the printing and mailing of those, as well as we also have funding for translation services for people who need assistance either with both oral translation as well as interpretation. And the last line that you can barely see, the 2478, is program administration, and that has gone primarily to legal notices. So again, for doing procurement of services, as well as things like tonight's public hearing and doing legal notices for that. So a few things, we have been trying to make modifications along the way, and that's part of why we're holding this hearing tonight, is so that we can get feedback and make adjustments. So some of the things that we have already done, so in the summer of 2021, we initially, when we had proposed this program, indicated that if you were receiving Care for Kids funding, that you would not be eligible to participate. That has changed. We are now, as I mentioned previously, covering the gap between what Care for Kids will cover and what the parents will cover. The other benefit to that is that with this program, we can take care of past due balances, which is something that Care for Kids will not do. They will only pay going forward once you are approved. We can help you if you are behind on your payments to your child care provider. Another change that we made, and this was working through the state, because we received the funds, any child care programs that the town runs, they indicated we could not charge overhead costs to the program. And so I think we've been very lucky that the administrative costs that have been identified have been covered either by the parental contribution or by other town programs such as camperships. And the town manager is authorized to allow use of grant program administration funds on a case-by-case basis. So if the parental contribution isn't covering the overhead, or if we don't have a campership or some other type of non-state or federal assistance that can help us with that, the town manager does have the ability to assist a family. The other change, and this came about in December of 2021 when we did an update for the council, is one of the things that we've noticed is that for extremely low income families, even 7% of their gross income is a burden and a struggle. And we had originally asked the state to be able to waive that fee for extremely low income families, and they said that they did not support waiving it. However, they would accept authorizing the town manager to reduce or waive the fee on that share on a case-by-case basis based on extraordinary need. So we now do have that ability if we have a family that's really struggling and that 7% of their income is something that is tough for them to meet, that the town manager does have the ability in extraordinary circumstances to reduce or waive that. The other decision that was made in December 2021 was to expand program eligibility to residents of Ashford, Chaplin, Coventry, Wellington, and Wyndham. We have not yet marketed that. And that really has to do with staff capacity at this point. We do want to grow the program, but we want to make sure that we can do it and provide the service. And so that's something that until we have that piece figured out, we're holding off on marketing this to residents of surrounding towns. Some modifications under consideration, and I'm going to let Jolene and Dorothy and Pat can weigh in on this, but these are some things that we're thinking about doing. For those of you who've participated in the program, you know that in February, we tried something new with a prepared meal option from a local restaurant. And we had a really good response to that with the survey that we did. People seem to really enjoy it. And so we are going to try and do that once a month moving forward. And so, you know, look forward to the next email asking you if you want to participate in March. Another option we're looking at is bulk meat purchases for large households. So that's something that we're exploring with a local grocery store. And I will tell you, it's a lot of meat. So if you're a meat loving family and if you have freezer space, this may, you know, if we can make this work, this may be something that you're interested in. And then lastly, we are, you know, continuing to look at the food process. Right now, if you're participating, you're aware that, you know, you're creating a grocery list and then inviting it to staff, either Dorothy or Jolene or Sandy, and they're handling that ordering for you. That is a very staff intensive process. It takes a lot of time. It's not the most efficient way to do this. And so we're trying to find different ways to do that. And we do have an RFP out to look to see if there's anyone out there, be it a grocery store, or if there's a financial provider that has a technological solution that can help us make this more efficient. Our goal is to retain the flexibility and the personalization of the current program. So, you know, right now you're choosing the food that meets your dietary need and preferences. And, you know, we think that's a benefit for multiple reasons. One, you're not getting a box of random food and I will tell you that was the original proposal when we had designed this program before, as part of the application process, that we thought we would provide food staples, you know, on a periodic basis, both perishable and non-perishable items, but there really wasn't going to be choice. And when we started the program, it was small, and we started out with this. And I think it's something that works better for participants because you're getting what you want and need. It's reducing food waste. And so we do want to, whatever direction we go, we want to keep those elements in terms of the food program itself. So that, as you know, as we do this, we're helping you get what you need, you know, and supplementing what you have. So, because I think that's the other piece that we do need to state, is that this was really intended as a supplemental program to help you and to help participants, but it's not intended to be something where we can cover your entire groceries. And I think everyone has been understanding of that as we've gone through the program. So with that, we're going to move into the public comment portion of the meeting. We did receive 3 emails prior to this evening's meeting with some comments, and it looks like we have some spacing issues on this, but I think you get the gist from the comments. And so these are from Jean, and then the next one is from April. And I think everyone that replied, Jillian, I think has been on just food, correct?
Correct.
And the last one is from Pat. So, you know, this, and I think this one gives you an idea. As I said, in terms of eligibility, it's not just income. You do have to have an impact from COVID. At this point, you know, a lot of our impact that we're seeing is the increase in expenditures, that's really where families are struggling, particularly seniors on limited income, that, you know, it's not so much that their income is being reduced, but their expenses are going up. And so this is providing a little bit of a lifeline during this time.
All right, I'm gonna stop sharing if that's okay with everybody, so I can see. There we go. All right.
So now is the time for questions and comments.
Hi, this is June. Get my phone set. I heard something while you were talking. It was a great presentation, and it gave me a lot of information. Purchasing cards. What can you say more about that?
So it's for us, when we do grocery orders for participants, we use it's essentially a card that's issued to staff by the town so that we can purchase groceries, similar to your credit card.
Okay.
So it's just something, think about your credit card statement comes once a month. That's why we don't have the expenses for February, because our cycle runs through the 4th of the month. So we don't have those expenses cataloged yet.
Okay, great, thanks.
So I think it's important to note that we recognize that issuing our participants some sort of a gift card would cut our staff time immensely, and but unfortunately the state forbids us from giving anything that even resembles cash assistance, which is why we can't provide you with some sort of gift card. We can only provide you with the product itself. That's a rule from the state that we can't.
It's and from the federal government.
Yeah.
Yep. Thank you.
Brian, I think you had
yeah, I got notice of this maybe a little over 24 hours ago. What's the rush on this public hearing? Can we, given the citizens a little more time? I think you're not going to get as much participation 24 hours notice.
So we're actually going to be doing another public hearing in October. So this is just one opportunity to get input and to hear what people are thinking about the program.
I'd suggest actually giving notice, many days ahead of time. That way there, I think you get a little more participation.
So it was published in accordance with the Department of Housing's manual on this program. So it was published, I want to say 2 weeks ago, also earlier this week. It's a little bit different than our typical noticing rules because it isn't associated with a committee. So, we can definitely hold another public hearing. That wouldn't be a problem.
How come it's not associated with any committee? Did this go through the town council or? These things
It
seem
did
like-
for
It seems like it's just flapping in the breeze here somehow. I'm not familiar with this process.
so it did go through the town council, and the town council held a public hearing at the time of the application. We wanted to get feedback, and again, this is an interim public hearing. If the council would prefer that we do these as part of a council meeting, we're happy to do so.
Very good. Maybe the next one in the future.
Oh, I think David is trying to ask a question. Oh, you're muted.
There we go. Yeah, I just got the information about this meeting yesterday, and I'll just note that I couldn't find it anywhere on the town website as well. So, even if it had been, but that aside, I live at Juniper Hill, and the residents are immensely grateful for the assistance that we're getting up here. I think you mentioned that you're working with Lori, the social worker up here, and so maybe it's more appropriate for her this question. But there's no. I'm not on dairy. I can't do dairy. I'm allergic to dairy, and in our menus they don't have that as an option. Is that something that you could address with Lori, or should I just talk with her directly, or what's the best way to handle something like that?
Yeah, so we can address that through the normal food assistance program. So yes, you and I can talk tomorrow, and we can address that through the grant.
Oh, great. And I've just a separate issue. The bulk of the grant money is not allocated yet. Is that what I saw on the chart?
It's not committed or expended, so it's still available. We expect that we're going to see an uptick in childcare applications with the summer coming because of summer childcare. So that amount is what right now is currently not expended. Again, we do have regular grocery orders that right now are ranging, again, from, I would say, probably about 13 to maybe 15,000 a month. As we add people, it's continually changing.
But the limitation is that it's for the food program, part of the program, it's limited to 6 months. So Juniper Hill couldn't expect an extension.
So we weren't sure when we started how popular this program would be with Juniper Hill. So to be sure that we could remain in budget, we set that limit at 6 months.
Oh, I see.
But depending on available funding, it's certainly something that we could consider.
Oh, great. All right, thank you. I appreciate
You're welcome.
everybody.
All right.
Jolene, and Linda, there was a comment put in the chat from one of our participants.
So it's from Mohammed Al-Bayadi. Thank you for all your hard work. Linda, you talked about the bulk meat purchasing. Is there any plan to offer halal meat for families who eat only halal? So I think, Mohammed, we can talk to you about those options. The meat program that we were looking at was from a local grocery store, so I'm not sure if they offer that, but I think it's definitely something we can have a conversation with you about in terms of trying to get what your family needs. Charlie?
Yes. Hey, Jolene, backing up a little bit. You said that it was published on, where was it published?
It was
said on the-
published in the Chronicle as well as the Hartford Current.
No, before that, you said something about the state or the FDA, something, or I can't recall what you said.
No, the legal notice was published in accordance with the manual that we have to use, which is like the 14 days, that stuff in the newspaper.
Oh, in the newspaper.
Yeah.
I guess my concern is that if people they don't get the Chronicle, that kind of would have not really helped very much. And I believe, as David has said, that he couldn't find this link today on the town website, which I also had trouble and difficulty finding. I actually got it through a friend. The modifications, although they're great, should they have been offered from the beginning, and should they not also have been offered before we opened it up to other towns? Perhaps we would have gotten a much bigger result. We could have used the resources, or probably will use the resources much better. And then lastly, do you think that we should have maybe do this quarterly, like say June or July, do another meeting instead of waiting all the way until October to see where we are?
Yeah, I don't think there's any limitation on how many of these meetings we should or could have. The noticing requirements are expensive, but luckily they are paid for with grant funds. So yeah, I think this is super beneficial. I mean, we've had these with the housing rehab grant, and we haven't had anyone show up. So this is really encouraging to allow us to do more of these meetings in the future.
Yeah, I think so too. I think we're just really kind of getting off the ground on this. Some of the Board of Ed members had no idea about this. And when I let them know, I think now they're going to get the word out. But I mean, this program was started almost over a year ago. And I think it would have been better if everyone knew about it. I think we would have had a little bit better coverage and perhaps a little more response on this program because of that. I mean, they're kind of taken aback that they weren't made notice of this.
Yeah, so I mean, I can't speak to what people know and what they don't know. I can only say that I work extremely close with the folks here in the building with regard to the schools. Shameen Patwa and I speak regularly with regard to this program. And I have also been to Goodwin. I have been to Southeast. We have another Goodwin program coming up next week that Dorothy is going to attend. So, I'm out at the childcare. We're talking to everybody that we can. So should have information gone out to all staff of all the schools, A, and then B, perhaps all of the Board of Ed members? It certainly did go out to the schools in the electronic backpacks. I don't know that we correspond directly with the Board of Ed, so that's a good point. It also went out directly to all of the daycare centers, and I have met with some of the daycare centers, and Sarah Dufresne, I met with the Mansfield Advocates for Children to try to promote the program through that avenue. So we're trying to reach as many families as we can.
I mean, I can just tell you that from my own experiences at my church, we have a food pantry there, and we have 35 regular people. And if there's any way that there was some hard copy stuff that I could even post up there, it would be wonderful.
Sure, I can definitely provide you with that.
All right, great.
I would just like to just say one thing. I work in the Human Services Department, and myself, as well as my coworker, any family that we are involved with, we speak to them about this program on a regular basis. I think something that needs to be kind of recognized is that some of the households are very busy with some of the activities that they have going on in their households. And we do everything that we can to try to hold their hands and help them with the application process. So we do try to provide them that extra support as well as continuing to tell them about the program. There is only so much that the staff can do in regards to the application process. So we are doing the best we can in our human services department to make sure that, any support that a family could use, we certainly are here. To the point that's been brought up before about, limited access to electronics. We've actually sat down with folks and actually helped them complete the application online. So to help eliminate that barrier as well. So I just wanted to let people know that.
Oh, and that's good to hear, Dorothy. The thing with that too is that even though they may have limited access, they may not have got any information because of that limited access. Some people may not have computers, or especially some of the elderly who do not, or don't even have access to the internet. And it's not even so much filling out the applications, it's getting the knowledge that the program even existed. And that was the
Right,
case in some cases where we heard when people were told of the program. First of all, some of the people thought it was that we were making it up. They didn't believe us. And some of the people were a little taken aback by it. They were kind of shocked that it existed. So at least we got the word out. But the thing of it is that just something to think about going forward, should we ever do this again.
yeah, I just wanted to let you know that that's what we've been doing on our side.
Yep. Thanks, Dor.
Oh, we have a few hands raised. I'm sorry, I don't have a name. It says iPad, so I'm gonna call on you.
I'm sorry, this is April Moore, and I'm using a friend's iPad, and
That's
she doesn't
okay.
have a name on it. So again, it's April Moore, and it's Morin. I live over at Rice Village. I did send in some comments because I was taking care of a couple of friends in hospitals today, and I wasn't sure I'd be able to get on the meeting. I did want to thank you for everything that you've done. I did want to tell you that back in December, I found out about the program. I was reading the town council minutes, and over at Wrights Village in December, UConn School of Business puts together a gift bag for all the tenants. So I contacted the Mansfield Housing Authority office and asked them if I could type up a letter telling them about the Helping Hands program, about renters rebate, about things that a new tenant moving in or tenants that live here may not be aware of. So we put that in the bags. I've talked to a few tenants, and like Charlie said, a lot of them don't think it's a real program, or they took the piece of paper and just threw it away, or are nervous about it. So my question for you is, do you think there's any way that some sort of flyer could be given to the tenants at Wrights? And I mean, certainly Helinco, especially because there's so many kids at Helinco, and either coordinated with Rebecca Fields at Housing Authority, or put directly here. Or, I mean, if you'll put a flyer together, I myself will distribute it to Wrights. I'll put it on all the doors at Wrights, if that helps. But is there any way that we could particularly go to Wrights and Helinco? Because when I think about low income in town, those are the first people I think of. I mean, I know personally, I have neighbors that like they're choosing between driving the car and eating, and I see the recycling bins and I know what some of them are eating, and there's not that many cats here, and a lot of them are not eating as well. And I don't know what else I can do to help them. So what do you think about doing a flyer purposely for those two? I mean, I'll do anything I can to help. Dorothy knows how to get a hold of me, Jolene does, and everything, but do you think that's something we could do?
Yep, Linda, I'm not sure if you want me to answer or you want to take this, but
Yeah. Go ahead, Jolene. You spearheaded it. So
we met with Rebecca Fields, and we are helping several people in Wrights Village. I happened to deliver Moe's to one of your residents just last week on a Friday afternoon. So some people in Wrights Village have gotten the word. We did meet with Rebecca Fields yesterday. We are in the process of sort of just kind of customizing our marketing materials so that we don't need to market childcare to Wrights Village. So
Right.
we're doing targeted marketing to Wrights and Helinco.
Okay.
We're trying to figure out the best way to print it so it doesn't blow, to maybe hang it on the doors. So
Right.
so we are in the process that will be happening very soon. We also think we're going to meet many of the Helinco families next week at the Goodwin Cares team thing that Dorothy is going to next week. So I do think we're gonna reach several of those families with printed material and in person next week.
Okay. That's fantastic. If there's anything I can do to help,
Yeah.
really don't hesitate, because I know most of them here at Wrights, and I help a lot of the neighbors already. So if there's anything I can do, please don't hesitate.
Oh, well, it's so
Okay.
nice to meet you after all of these
Thank
months
you.
that we've
I
been
know.
working together. It's really nice to meet
Yeah.
you.
It's nice to meet you too.
Thanks,
Thank
April.
you.
I think June and then Brian. Oh, and Ryan also has
Hi.
his hand raised.
How I found out about this program was that we got a notice that the people who at Juniper Hill, I live at Juniper Hill, that they were going to get their lunch paid for through this program. And so I was like wanting to know about it. I'd never even heard of it. And so I contacted Lori and asked her, well, who's administering this program at the town hall or wherever? And she didn't answer. And so I was really concerned because I don't take the meals because I have a lot of restrictions as far as what I can eat. And I thought, well, if they can, maybe I could qualify. And so then I called the town hall and I spoke with Jolene, and she said, she would send me the application process. And it happened that we all qualified here for assistance with food. And so I've been able to order some staples it's at the month of February. And but I'm just wondering if, because I searched to find out where this program was written up. And I did find it on some website for the town of Mansfield. And it's there, but nobody ever says, where to go. So I tried to pass the word along to some people about, here's where you can find out the information about that. And here are the people at the town hall who are helping people to, but a lot of people here at Juniper Hill that can't choose not to eat the food here for whatever reason, are also qualified because of, the HUD subsidized housing that we are in. And so I wonder, I feel a little frustrated because I was trying to pass the word around and nobody seemed to pick it up and run with it. But I'm not in charge here, but I do like to let people know what's going on. And still have had no response from the administration about the fact that we're all qualified and here's how you do it. And it's got, it's been a little difficult for me, when I go to order, and I can understand how you want to streamline that situation. Would be helpful to you and would eliminate a lot of, work. But there's so many people that live here who could qualify for the food assistance, and how is that not happening here at Juniper Hill? It's big enough here that somebody could be in charge of that. So that's it.
Thanks, June. And I know that, Jolene was working with the social workers, and so that was where the paying for one of the meals came out of. And I think both you and David tonight are two people who have identified that the meals that they provide don't work for you for dietary reasons. And so for folks that have dietary restrictions, we will work with you to get you on the regular food program. I think we'll have to talk to the social workers about how to get that word out more, because they're our main conduit to Juniper Hill residents in terms of participation in the program.
Can I just tag on a little bit on the Juniper Hill one? There's 64 units in the main building where the where the cafeteria or the dining room is. And then there's 34 units that are in the cottages that are not down there. And they do deliver down to the cottages, if and people can can have that. But my question, just tagging on to June's, is is it possible for people like her and me, even though Juniper Hill gets the grant, is it possible for us to apply separately?
Yes.
And maybe somebody,
Yes.
it is possible. Okay.
Yes, it's
Oh,
absolutely.
I already did that process with a number of people. and it, I thought that it was pretty easy once they got things rolling, so.
And the other issue, I know you've got an RFP out for people, for companies who can assist with the delivery of the food, the putting together of food. And you mentioned grocery stores. Have you reached out to any of the, the online food delivery services, the DoorDashes and, places like that?
Yeah, I mean, Dorothy can probably speak a little better to this, but yes, we very often, for our residents that do not have transportation, and this is one thing that we said we were going to do in the grant, is contactless delivery. So we do provide delivery through Instacart. I mean, it's a little complicated because, your Aldi's have their delivery, your Stop and Shops have their delivery. So it gets a little complicated, but yes, we do provide delivery for those who need it.
Thank you.
Ryan, you have your hand raised?
Yeah, I'd like to
Yep.
jump on a good idea. April had a good idea, distributing flyers. I'd like to distribute flyers to my tenants. If you could get me 65 flyers in my mailbox, I'd be happy to hand them out.
Absolutely. Brian, both food and childcare, or would you like it tailored one or the other, your materials?
I would do mostly food, but
Okay.
Maybe a quarter of them would be childcare.
Okay.
Thank you.
Great. I'll get those to you.
Charlie?
And I wonder if we shouldn't be also targeting Jensen's. That's a fairly large community, and maybe a second run through there if it got, obviously you probably did send stuff in there, but I would imagine that it couldn't hurt to go there. And then secondly, I would imagine that that there's probably a little bit of difficulty with the Gen X, Gen Y generation interfacing with the Boomer generation as to perhaps why this technology didn't work to getting the message out.
Well, again, I think we did do a townwide mailer. That was one of the first things that we did. Unfortunately, with those mailers, they don't always, grab someone's attention. They may forget about it. It may get tossed out. And I think to April's point, I think some people may look at it and go, this does not look like it can be real. Like this, you're telling me you're going to help me with food and childcare costs. That doesn't sound like something the town of Mansfield is going, or our government is going to do. And so, we can work on another mailer. That's part of that we do have budget to do that. We can do flyers. We've tried different methods of outreach. We did bookmark distribution with the library. So anyone who got a book last year during a certain time frame would have gotten a bookmark with the information on it to contact us. So we've tried a variety of different ways, including the Mansfield Community Center Family Fun Night. Jolene and I spent a nice Friday evening with families wearing tracker ears from Paw Patrol, and trying to get the word out to families that were at that event. So we're always open to new ideas and in terms of how we can promote the program.
Did we have a booth last fall?
We didn't have a dedicated booth, but I believe our materials were handled.
Town
by
manager's
the
office.
Town manager's office, yeah.
You see what I mean? I'm just curious about, how this interface could work a little bit better. Not even so much for this program, but going forward. Because it seems like something got lost in the wind here.
Ryan, you've had your hand raised for a while there.
Thanks, Linda. Yeah, I just want to take a moment to, I'm Ryan Ellsworth, town manager. Video is deactivated so you don't see kids running and screaming in the background. I just wanted to take a moment to pass along my own personal appreciation for all the hard work that the staff has put into the program to date. And I also want to thank all members of the public that have participated tonight. It's really helpful to get the feedback. Administration of the program really, does require staff to provide above and beyond effort, because this grant falls essentially outside their normal day-to-day job responsibilities. And so along those lines, for me, it's heartening to see that the positive response is there, and that there are real benefits of this grant funded program to many different Mansfield families to this point. And I guess I just want to close by saying I'm sure I speak for everyone, including members of the council, when I say that we're committed to getting this right. Town staff are going to continue to source out ways in which the program outreach and the delivery and implementation of the program can be that much better. And ultimately, we want to expand our reach to more families and meet those families in need. So, again, kudos to staff for all your hard work to this point, and look forward to closing out strong during the calendar year.
So we do have a few. Charlie?
And I'm by no means, I don't want to say to disparage anything, the work of you done. I mean, it certainly is a difficult program. You did get the grant, which was a wonderful thing, and it's being implemented. So, by all means, getting it going and people being able to take advantage has been a very good thing. So with that, I would say thank you.
Well, and I think one of the things I'll say is we do rely on word of mouth. I think, some of our program participants find out about this from their neighbors. As April said, trying to spread that word, that's huge, because especially, the people on here this evening who are participants, you can attest to what this program does. And, there's going to be more trust sometimes in what you have to say than maybe is going to come from a flyer or from an article or something else. So, the more that folks can do to kind of spread the word about this, the better, and the more we're going to do, the more people we can serve. And again, we always, want to hear ways in which we can help. And so I think we've gotten some great suggestions tonight on outreach. And Mohammed, we will be in touch regarding halal meat and to see what we can do for you on that. We do have a few folks who have not spoken this evening. So if you have anything you'd like to say, any other comments, Ms. Charles Harris? Or Vera?
I got a big mouth, so I should be able to help spread the word for you, Linda.
Thanks, Brian.
Thank you.
And the flyers will be that's great to send to your tenants. We again, coming from a trusted source, it may get more attention than if it comes through the mail. Charlie?
And a couple other places too, maybe at the food share truck when that hunting hall gets set up, and then maybe targeting our TFAT people directly, and then perhaps at the farms to families thing as well, maybe.
And I'm gonna let Dorothy or Pat respond to that, because I think Dorothy does the Farms to Families, and so she works on both of these programs.
Yes, so our Farms to Families program, we do have quite a few households that we have that are qualify for both programs, and we're starting our Farms to Family program again this year. So last year, a lot of the participants that were participating in our Farms to Family program is aware of this particular program. And again, it's you know, trying to encourage them to go through the process. I know that sometimes with a lot going on, and you have a lot of events in your family, it's just sitting down and getting the time to complete the application. So we are working with those families to try to get anyone that's already qualified for our program to give them the support to get them, their application in for that program as well. I just want to say there is some caution with promoting this program with food share. Food share, anyone can participate in the food share program. So we get residents from Vernon, Manchester. We actually have participants that follow the truck all day. So they may not necessarily be in a community that's in Mansfield or the surrounding area that Linda is looking at reaching. So there's just a little bit of caution with that, because some of those participants might be in an area that Linda won't be covering at this point. So that's just some food for thought.
Ryan has his hand up.
I don't know if that is still up from before, or
Sorry, I
Just
left
wanted
over
to check.
before.
Pat, you had your hand up.
Yeah, I just want to again emphasize that not only through our social service programs, like for example, food share, it may not have been appropriate to hand out to every resident everybody that came through food share, but the staff are out there and they have talked to people who participate in food share that are from Mansfield as they were going through, either directly or at other times. I'll also say, and the same thing with TFAP, they can be from area towns if they sign up. So again, that was a little more concentrated because we were only initially doing Mansfield residents. I can say it's been pushed out through every single blast that we have, including the senior center and the different ones that youth service offer, as well as the human service Facebook page, blasts that go out. It's gone out through the town website, the town Facebook. And so it has, and I and other staff have spoken directly to other staff from other agencies that serve Mansfield residents. I have staff that have actually gone over and encouraged and helped people apply for the program that they know of, either at the senior center or through other things. So, we have really done a lot of one-on-one outreach as well as through our different sites. So you can always improve, but I think this is probably one of the best publicized programs that we have going on right now. So I do want to say kudos to Jolene and Linda, because they have done an amazing, and Dorothy, they've just done an amazing job of getting the word out. It is a difficult it's more involved to apply for this program. They've made it as easy as they possibly can and still follow the guidelines. And some people, again, they can see something 4 times and it still hasn't resonated. So I agree with Linda that word of mouth and just looking to see how many multiple ways we can expose people to it is the way to go with it. I also want to say that it's a much more streamlined now. It was a real challenge in the beginning because we had some challenges backing into the guidelines that that were put out through both the federal and the state people administering the program. So Linda and Julene didn't talk about that, but they really did an amazing job advocating for the people in Mansfield to make the program work for us.
Thanks, Pat. Vera?
I just wanted to say that I think that it's commendable that people who have full-time jobs with other titles have been able to take this program on and get it out as best they could to all those that they're serving or trying to serve. So with the added suggestions, I think that's good for you to follow up on if you can. But I also think it is first a wonderful program, and second of all, you've done a tremendous job given the constraints and the red tape. So I just wanted to say that to all of you.
Thanks, Vera.
Thanks,
So
Vera.
one of the things I did want to note is that we're trying to streamline the application. I think, Dorothy has identified that, and that is one of the challenges for us, is given the source of the funding and some of the federal rules, it can be daunting, and we do try and work with residents, but sometimes just even the time to compile the documentation that we need can be a challenge. One of the things that I'm happy to say is that we did talk with, when we talked with Rebecca Fields, it sounds like their residents have the same income qualifications that we do. So we're hoping to do a streamlined application process for anyone who lives on the Housing Authority property. She did mention that she has a couple that are over our requirements, but they know who they are. So that's something that, hopefully we can reduce the amount of documentation that people need, just like we did with Juniper Hill.
Yeah, so just on that note, we were able to do that for Juniper Hill, and Linda and I tested it out at lunch a couple weeks ago, where we sat down and had lunch with your residents, and we were able to get around 12 people.
It was 14.
14 people
14.
signed up, and it took about 2 to 3 minutes maybe per person. So we worked a lot with the forms to make it easier. I mean, we're building applications. Not only are we buying groceries and building websites, but we're building these applications from scratch. And it's not easy. So we'll do a similar thing to Juniper Hill, and we'll do that for Helinco and Wrights Way to make it easy for those residents.
Yeah. And I also want to say, Vera, I think that you're on the board for Juniper Hill. And I just have to say, at that lunch, every single person we talked to loves Juniper Hill and just had nothing but good things to say about the housing, the staff, everything. There, so it's a great place and I'm glad we have it in Mansfield for residents. Oh, and we just received something. So thank you everyone for all your hard work from Sean Charles Harris. Any other comments this evening? David? Oh, you're muted.
Sorry. Just so now that I understand how it works with Juniper Hill, it's actually on 2 levels. And I think it was brilliant for you to target Juniper Hill and get a whole bunch of low-income people in one place at one time. That's just amazing. You might also want to reach out to the residents group. Because we communicate, directly with the residents as well. So the Juniper Hill Residents Group is actually how I heard about it this meeting from Ron and Joanne. And actually, I'm also on the executive committee of the residents group too. But please include us. In Ron's the president, and and so anything that you do through there. And I'm particularly interested. I know if you sat up in the dining room, that's great, but that doesn't necessarily get to the people in the cottages. So we can maybe help with that.
So I am scheduled to come, not next week, but I think the beginning of the week after. I'll be taking appointments, and I'll have an iPad and maybe somebody else with me, and we'll be doing applications for people right there. So I can come to the cottages, they can come to me, but the way we've set up the online application, like I said, it's 2 to 3 minutes and we're done.
Brilliant.
Great.
Thank you so much.
Thanks.
It's a great program.
Thank you.
And we have another comment in the chat from Mohammed. Taco kit was great. Thank you. So we're glad you enjoyed that. Again, you will be getting something for March. So we're targeting Friday, March 18th for another prepared meal option. So more to come on that. We've already started our outreach to the restaurant we're looking to work with. Brian, did you have your hand up? Okay. Any other comments this evening? All right. So I think, thank you all very much for joining us this evening. And I think, given the feedback and again, the attendance that we've gotten, I think we'll look at trying to do, another one of these in a few months and let folks know how things are going and, what adjustments we've made and how things are working.
Email me when the flyers get in my mailbox, Linda.
All right.
Thank you.
You want us to just leave them in the manager's office?
Yes, that's fine.
Okay, great. Thanks, Brian.
Thank you. Thanks, everyone.
Thank you, everybody.